weapons exposure. And this is what makes me laugh, is even coming from the Washington Post. The company that makes it won't say whether it works. Now, isn't that enough for people, even the people in the mainstream, to question these things? But you see, it's not allowed to question the gospel of vaccines, even and especially not allowed to question the ideologues of the gospel of vaccine, like people like Robert Cadleck. You cannot do so. And that has to show you where we really are. Now, according to internal company records and emails from Emergent employees and government officials obtained by the Washington Post, the article continues, it says Emergent's Director of Regulatory Affairs, Brenda Wolling, stated in July 2017 that functionality, quote, testing has not been successful in this device. Speaking of Trobigard. On the record with the Washington Post says, and that's why I find it interesting that they pretend like we're not going to comment. She stated that it was not successful. And yet this is being used and spread and sold and claimed as safe. Let that reflect on where they are in the position now in regard to selling you another thing that might not be safe. And it says, and that even describing Trobigard as, quote, a treatment of nerve agent poisoning, this is what she's saying, was inaccurate because that claim, quote, implies that we have efficacy data showing it works. Right, so that claim suggests that we did anything of any sort that we were supposed to do, and we didn't do those things. So you can't say that. That's reality, guys. This is the group working on this dangerous vaccine right now. Or excuse me, I'm going to be very clear. The group that is basically chosen to manufacture 4 of the leading vaccines. Now, I want to make sure we're clear on that. Now, it says Emergent Biosolutions declined to answer if the inaccurate marketing claims that Trobigard had been tested for safety and efficacy had been made to State Department officials prior to the awarding of the first contract for Trobigard in October 2017. The company, however, did however state that Wolling's claims had been, quote, taken seriously, but they did not show you who and what these people are. That they don't care about the crimes and anything that they force onto us. The laws and the things that the regulations and the mandates and all these things that we have to apply to and we have to live by. Even at a higher level, things like UN mandates and UN resolutions and deals and treaties and resolutions, they don't care. They will simply drop it and run the moment that it's not to their interest. And that is exactly what this shows you. And these are the people that are trying to tell everybody that we're only doing things for you. Only. It's only about you and your benefit. That's it. As they continually enrich themselves and continually do things to exactly the opposite end. Now, some of Trobigard's issues, it goes on, were so glaring and obvious that they resulted in public recalls. Now, again, this is real-world examples of exactly what this is saying. They didn't work, and they were even recalled in certain locations, too, this article goes over. Now, with the company recalling 61,000 units that had been sold to the United Arab Emirates in January 2019. Interesting timing of all this. Now, I'm not going to say that I feel that they're necessarily connected, but the fact that these are the same people, the same company, in regard to bio protection, I guess, and it's in 2019, a year before we got here, who knows what this could be. We could be watching some kind of this is just total theorizing, but the fact that I think these people are clearly dishonest, willfully putting people's lives at risk. Why would we think that the same government that's working with them, that's also tested on unwitting Americans and people abroad over 239 times they've admitted to, would not do it now again, either in the UAE or elsewhere? Just something to consider. But they recalled 61,000 units of whatever this thing that they say didn't work in 2019 in January. Now it says, while Emergent's contract with the State Department obligated them to report, quote, any issues with the safety and efficacy of the delivered or ordered products and or manufacturing or quality of the production lines in a timely manner, it says the company argued that the recall in the UAE was just unrelated to the State Department orders of the very exact same product, that they were just different product batches. So we're not going to report that they clearly didn't work and had to be recalled. And even though we know you didn't test them and you've admitted you didn't test them and on and on and on, but that wasn't the same thing. Just don't look there. And of course, the government said, oh, sure, we'll look the other way. Of course, doesn't that show you where we are? Now, it says the end result of Trobigard's troubles was ultimately Emergent's quiet decision to relist it as a product in development as opposed to being marketable, right? So they just took it back one step. Well, it's still there and you can still buy it, but it's only in development. So we're not sure about how it will work. I mean, it's just this is the most obviously fraudulent activity, just trying to continue to make a buck off something they just don't care whether or not it hurts you. But they moved it to a from a marketable product to a in-developed product on its website. And to require that all future sales of this thing that they just moved back a step, but still just as dangerous, be approved by their Emergent's medical, legal, and regulatory departments. I argue because anybody that they don't know will keep quiet, they want to make sure they don't sell to. That'd be my impression of what that means. Now, Emergent has nonetheless maintained that Trobigard injectors sold to the State Department, the same exact thing we're talking about, are safe. They've continued to say, still, those things we've never tested that everyone else says is dangerous, that we've recalled from UAE and from France, but I think the article says that they did say that one did happen. Nonetheless, they're still saying it's still safe, though, for you, despite having admitted that no safety or efficacy tests of the product in humans had ever been conducted. That seems a little contradictory. Don't you think the State Department, if they cared at all, would be like, wait a minute. How could you know they're safe if you've never done tests, but we don't care? This is the company has continued to receive payments from their multi-million-dollar contract with the State Department, the last of which was made last September. Money coming directly out of your pocket. That's tax dollars going to a company that is willingly putting people at risk for profit. Just let that sink in, and please let that reflect on exactly where we are now with this same company working in the same way with the same people. Now, Trobigard's issues actually seem to be the very reason why Emergent sought to market the dangerous product, according to the article, to the State Department specifically in the first place, as marketing and product for use by U.S. diplomats overseas allowed Emergent to avoid needing, the things that they have to do, that they make everyone else do, the approval from the FDA. Right, that thing that everybody else, no, they just kind of skirt the rules, don't test, do what they want, avoid approval. Of course, which, as the article points out, is necessary for the product's sale within the United States. Now, in order to facilitate Trobigard's sale without FDA approval, Emergent sold Trobigard to the State Department, of course, through a subsidiary based in the UK, and had the injectors assembled in Europe, where the finished product was then sent to the US embassies around the world. Totally legit. Now, think about how ridiculous it is. As I keep talking about, this goes into the public-private stuff as well. The idea that right now we're watching these governments, and specifically our government in the United States, with other foreign governments as well, basically set up these supposedly public, startups and different things that are just extensions of the government. And this is exactly the same thing. This subsidiary based in the UK, this is just them. That's them finding a way to circumvent the law with something that they've admitted doesn't work, admitted it's not safe, and has even proved real-world scenarios that they weren't safe and had to pull them back. And yet they still said, yes, for you guys, for Americans, you're good. It's all still safe because Robert Kadlec says so, Emergent Biosolutions says so. This is obscene. This is so incredibly gross. This makes my skin crawl to see how obviously fraudulent these people are. When I say these people, I mean the entirety of the government from Obama's administration to Trump's administration that have allowed this to continue to happen. Now, you could argue that a lot of this stuff happened in between. You could argue that a lot of this stuff happened, without their knowledge. Things like they're trying to pretend is, like Fauci and Trump today, where he's kind of behind the scenes making these things happen, which is certainly could be true to some degree. But at the end of the day, have all of this happen over all these years, times where they needed funding that did go to the desk of the White House. The point is they knew this was happening and they continued to toe the line. That is the reality. You need to see that. Hopefully people can see that. Now, Trobigard is not currently approved for use by health authorities of any nation right now. Anywhere. Yet your government is still spending your money to buy it and sending it out to embassies all around the world. How does that possibly make sense? Only when you realize who these people are. Now, as well as considering what else may be going on with that. Now, despite the obviously dishonest actions of Emergent Biosolutions, the Department of Defense recently awarded them, after everything we just talked about, another contract worth up to $75 million to, quote, develop other injectors for potential use by troops to counter certain kinds of chemical attacks. The same group. No problem. All these issues, all the problems from anthrax to today with these lying about things, pretending you've got safety testing, nothing. Here's $75 million more dollars to do more of the exact same thing. I mean, it's just incredible. It really is. Now, the company's notoriously close revolving door ties to the Pentagon, as well as the Department of Health and Human Services, in addition to its intimate involvement in the anthrax vaccine scandal, as the article goes on, where the Pentagon was found guilty, as I continue to tell you, in 2004, of illegally using emergent anthrax vaccine in an experimental and quote, off-label way on U.S. troops. This is the reality. It's incredible to see these same people involved with that then doing this now. Doing it then, doing it again with certain things and again with certain things and getting caught again and all the way to today. It really does stand out more than most situations I think we're staring at today. Now, the company, we're talking about Emergent Biosolutions here, was involved with this in regard to anthrax, which was involving Robert Cadleck, involving all the same people we've mentioned. It's a very big deal to understand that they lost this. They illegally, knowingly sent something out that was dangerous. Now, the 2004 ruling focused on the Pentagon's mandatory anthrax vaccination campaign for U.S. troops, which began in the late 1990s, and the fact that Emergent Biosolutions' anthrax vaccine, marketed as Biothrax, had, but important to never been subjected to either safety tests or tests that provided its efficacy per its intended use, protecting troops from the inhalation of weaponized anthrax. Now, does that sound familiar? It should. I just read it from a recent story. So in the 90s, they put out an anthrax vaccine that was never tested, never proved to be safe, and in fact lost a lawsuit because of that, showing that they did that. Then they make Trobigard. They do the same thing. Don't test it. Don't prove it's safe. Sell it anyway. Government buys it. Prove that it doesn't work. And now they're giving them $75 million to keep working. And guess what? They're also going to be involved with 4 major vaccine companies in regard to your COVID-19 vaccine. Let that sink in. Gee, I wonder if they're not going to test it for safety. Maybe it's a clear track record they seem to have. Like, look, the fact that even saying something like that can probably get you censored, but understand how clearly, verifiably, obviously true that is. They have repeatedly been caught for not testing for safety or efficacy in the products that they're putting out. It's incredible. Now, the ruling was essentially circumvented, of course, by the Pentagon, showing you again exactly who they really are in 2006. So 2 years later, after being ruled that they knowingly put out a vaccine that put people at risk with this company that lied and made this happen, 2 years later, they just went right back to it. The military decided to resume mandatory anthrax immunizations among U.S. servicemen soon after the FDA approved Biothrax. Yeah, the same one they just got caught for as a treatment for anthrax inhalation. Despite no in-depth studies on Biothrax efficacy or safety being conducted following the 2004 ruling. So basically, after they ruled that it was dangerous in 2004, after they said, yeah, that thing's dangerous, and you guys knew it, and you pushed it anyway, you're all in trouble. 2 years later, they go, Biothrax. Why don't we give that a shot? Tried it again. Without any testing, without any difference, the same scenario. I mean, how is that even possible? The only world in which I can see something like that happening is one in which is completely controlled by the same people. People that can pretend, ooh, you're in trouble for that thing that we all were a part of, and then 2 years later, let's pretend like we have a new thing that's the exact same thing from the same company and the same people involved. Now, as Whitney writes, the recent revelations about Emergent's biodefense product, Trobigard, show that the company continues to follow the same corrupt playbook, with the firm relying on their connections to government officials, thanks to the public-private revolving door, and their own veritable army of lobbyists, which is incredibly important, to sell untested and unsafe products to the federal government. Lobbyists control our government, whether they're APAC lobbyists or big pharma lobbyists or any other lobbyist. They're massive, massive. They control our political system today. And who controls them? That's a further discussion. But the point is that's money through basically bribery. That's what lobbying is. They're giving them money in hopes that they'll influence the campaign. But understand, the whole system works on the idea that they know that they'll have influence. Otherwise, they wouldn't give them money. Now, of course, you can argue, well, it's because they believe in them. Sure. To some degree, some of them do. But understand that it's obvious, historically obvious, that that's not the case. I mean, I just played that video again in regard to corruption is legal in America, showing you that regardless of how many people care about a policy or a bill, it has the exact same percentage of passing. Whether no one supports it or everyone supports it, it's the exact same, which shows you have zero effect on actual politics in this country. But let's keep marching forward as if we're going to vote somebody new in tomorrow. It's disconcerting. But of course, I used this image because I had it already clipped out for the main one I made today. But figured I would just use his face over the top of it. But that's Mr. Robert Kadlec right there. Cute little Kadlec. One of Emergent's greatest enablers in the U.S. government, the article reads, today is Health and Human Services. And here's the title, like blanked at the end. Of course, I can't believe I forgot that part. Assistant Secretary for Preparedness and Response. I kept thinking Health and Human Services. It's the HHS ASPR, the ASPR. But he's the Assistant Secretary for Preparedness and Response. As I keep saying, the person who's completely in control, solely in control of the Strategic National Stockpile, which puts him in a unique position to pick all the things that will be the ones that get chosen, which means they get the massive billion-dollar, million-dollar contracts. So guess what? If he can pick things that benefit him, well, it's going to benefit him. This is the very key part here. The Assistant Secretary for Preparedness and Response, Robert Kadlec, who was once, and I would argue still is, a lobbyist for Emergent, who also co-founded a biodefense company, which we've mentioned in the show in the past. This is a company with Emergent's founder, in fact, Fouad El-Hibri. We've mentioned before, I think, in 2 different shows, who was the guy who basically helped outsource the anthrax vaccine to Saudi Arabia and has, interestingly, ties to International Porton Down, which is obviously another biomanipulation story, and many others, by the way. Now, Kadlec informed one of Emergent's top lobbyists, Christopher Freck, about a, quote, potential opportunity in Japan after an official visit to the country in 2019. Now, a spokesman for Kadlec later stated that, quote, Dr. Kadlec was contracted by Japanese senior government officials asking for American suppliers of medical countermeasures in preparation for the Olympic Games. And Kadlec provided them contracts with multiple suppliers. Now, I just find it very interesting that we have all these things happening. 2019, the time frame where, okay, look, for all the different theories out there, for people that may have intentionally made something happen, when we're seeing groups like this that are tied in with clear experimentation and doing things just like that in the past, you wonder, as you see these examples of them giving out bio things around the world, whether that has something to do with this scenario. Just a thought that popped into my head. The timing seems interesting. Now, during Kadlec's tenure at Health and Human Services, which again is really important to see the tie-in with that and where we are today, be it Alex Azar, any of the people we've mentioned here, very relevant. But his tenure at Health and Human Services, Emergent Biosolutions has become the largest contractor to the Health and Human Service Office, which he oversees, because that's not a conflict of interest at all, and which also now exercises complete control, as I keep pointing out, over the Strategic National Stockpile. And as Whitney has pointed out in many different articles, Kadlec spent the better part of his entire career actually orchestrating both the creation and the creation essentially of the Strategic National Stockpile and the consolidation of its control by the single office which he now holds. Just look at the obvious trail of control there, where he created a situation that basically consolidated control of the very thing that he later took control of, by the position that he personally created. That's just ridiculous. Let's pretend like that wasn't just exactly what the plan was. Don't forget who that person is. He's very relevant. There he is again. Now, Kadlec, whose office is also in charge of major aspects of the U.S. government's entire COVID-19 response, is in large part responsible for the fact that Emergent Biosolutions is now set to play a key role in the manufacturing of, again, at least four of the leading COVID-19 vaccine candidates, despite Emergent's track record involving the sale willingly the sale, knowingly the sale of untested, unsafe, and non-functional products. How is that even possible? That's just incredible to me. And just to show us, as the article reads, that the last thing our government is concerned about is our safety, the U.S. government itself has now awarded Emergent a $628 million contract on top of everything else we've talked about by the Biomedical Advanced Research and Development Authority, which we've mentioned a few times on this show, which is a division of the Health and Human Services overseen by Robert Kadlec's office. It just goes round and round and round. So he essentially funded his own interest using your money. Totally normal. Isn't that exactly what they pretend Iran is doing? Or maybe, but they're probably, governments around the world are enriching themselves on the back of your suffering. So it's kind of ridiculous as they scream about other governments enriching themselves, even as they're being strangled with sanctions, as they literally do that, as they literally just stole trillions of dollars from your pocket and gave it to big business. And as they're basically funding their projects all around us right now with your money, saying it's for you, as you can't feed your family. Now, the contract essentially ensures that Emergent will be involved in manufacturing the U.S. government's COVID-19 vaccine candidate. The one that they choose, of course, in spite of their horrendous track record of, lying to you, deceiving you. Their track record of being exactly what they say everybody else is. The lying, deceiving, manipulating government that hides things from you and in fact puts you at risk with the actions they're doing for no other purpose than to benefit their agenda themselves. Profiting, control, however you want to look at it. I mean, this is exactly where this. I look at it like this. This is a microcosm of everything else that's going on. Kadlec is one person in one position in one entity, in one larger entity. So extrapolate that out. And think about what we're staring at right now. Now, sure, I argue that not all that way, but you have to realize this is a person that is in the very administration that right now all of his supporters think is fighting that. How does that make sense? Of course, even worse is the other side is just happily going along with it. So either way, you got one side openly going along with the bad thing, the other side pretending they're fighting it, and in reality, he's on his administration. He's helping him achieve it. He's helping using the military to run. I mean, everything. It's so clear. The coordination of all of this. It's incredible. But the reality is that this is going to continue unless we do something about it. Unless people stand up and say, we will not allow this. Because we talk about the boiling frog, the totalitarian tiptoe. It's going to continue. If we don't give some kind of pushback, they will continue to roll it out until we say, whoa, this is too much now. We're already seeing people kind of start marching through streets. We have militias and all. I mean, they're going to use this to try to push back. They're going to use it to try to claim that, look at these, rioters and they're not protesters at all anymore. They're going to push on this. But the point is we need to continue to stand for what we believe in. Because look, just to continue on with some of the things that should make you uncomfortable in this scenario, after everything that we've talked about Robert Kadlec and Emergent Biosolutions and every other situation in regard to the vaccine that should make you concerned, realize, as somebody just recently pointed out, they're not right now including women and pregnant women and children in their vaccine trials. They almost never do. Which, first of all, that's because they're dangerous and they hurt people, and no one can deny that. But on top of it, we need to realize what this shows you. That, okay, if we in a discussion where the reason they exclude them like in the past is because they're not forced. And they know that it could risk them, so it's not worth it. But now we're talking about a situation where they're openly discussing mandatory vaccines across the board right now. As even as people on the blue checks, I keep calling them on Twitter, the social media influencers that are really more lost than anybody. They're the people out there screaming that we're conspiracy theorists, as you have mainstream articles, leaders of government across major institutions saying we need to make this mandatory. And they're like, you're a crazy conspiracy theorist.